Hello and welcome to the show, folks. I have an amazing guest with me today. I have Dr. Brian McKenna. Hi, Brian.
Hi, Leanne. Thank you for having me.
You're very welcome. Thanks so much for taking time out of your very busy schedule, seeing clients today to talk to us.
Most welcome.
If you do not know Brian, he is a family physician here in Hamilton, Ontario, and he provides obstetric services at St. Joseph's Hospital through the maternity center here in Hamilton. That means you deliver the babies.
I do care for moms while they're pregnant, deliver babies, and then care for both of them afterwards.
Wonderful. So you're going to know all about preeclampsia.
We can have that chat for sure.
Yeah.
Fire away.
All right. So tell me, what is preeclampsia?
So preeclampsia, medically speaking, is what we would describe as a chronic progressive disorder. So once it's systemic progressive disorder that is characterized by high blood pressure and then signs or symptoms of end organ damage. Now, what that means in English is that it is a condition of pregnancy that is characterized by a spike in blood pressure in the second half of pregnancy. So typically, at around 20 weeks or later. So if your blood pressure is high when you're 9 weeks pregnant, we would assume that it may have been high before your pregnancy, and it's high blood pressure like anyone else's high blood pressure in a non-pregnant individual that has nothing to do with your pregnancy. But if after 20 weeks, somebody with no previous history of high blood pressure starts to develop blood pressure that is going up, along with other signs of, again, what we describe as end organ damage, most characteristically protein in the urine, but there are all kinds of other features that we look for as well. That is what would qualify as a diagnosis of preeclampsia in a pregnant person. And it's important because although it starts out as something relatively silent and seemingly indolent, the potential consequences downstream are severe for both mom and baby.
So for the folks who are watching, a little trigger warning here. We are going to talk about a couple of these negative consequences, and they are not insignificant. So Brian, what are some of the problems that someone who develops preeclampsia could potentially be facing?
So when we talk about, preeclampsia being a disorder of high blood pressure, along with these symptoms of or signs of end organ damage, that it is damage to those organs that are the potential sort of consequences of preeclampsia, along with other things. And so we talk about pre-eclampsia. Well, what's the pre? Eclampsia involves this high blood pressure with signs and symptoms of end organ damage, but also grand mal seizures. So a horrible, horrible consequence of preeclampsia, if progressive, not controlled, not diagnosed in time, is a grand mal seizure in a pregnant person that could ultimately sort of result in fetal loss. It can be life-threatening to mom. Very serious.
Okay. And so for that reason, then we test for it regularly in pregnancy, right?
We do. So one of the reasons that, anyone who is pregnant should receive, routine, scheduled, ongoing prenatal care on a regular basis is because at each visit, your blood pressure will be monitored. And oftentimes there are certain exceptions to this based on guidelines, but your urine will also be checked too. And the reason we do that is because anyone who develops a blood pressure of above 140 systolic or 90 diastolic, which would be the top and bottom numbers respectively, who then also has protein in their urine or other signs and symptoms of preeclampsia, which we can also talk about, they need to be monitored very carefully and in a slightly different way than someone who does not have a diagnosis of preeclampsia.
Okay. And if we're starting to see those signs, especially if we see them very suddenly, right at the very tail end of pregnancy, so 37, 38 weeks seems to be a really common point for this to happen for folks, where the blood pressure might spike really quickly and quite high. What's the response from physicians?
Yeah, so 90% of pregnant individuals who develop preeclampsia, the condition will be sort of first diagnosed or first recognized after 34 weeks. And those tend to be the patients, again, and we're talking in general terms. There are always exceptions, and we never say never in this business. But in general terms, those are the people that may go on to develop high blood pressure. They may have protein in their urine. They may have other lab abnormalities and symptoms that are consistent with that diagnosis of preeclampsia. But typically, as long as they have their baby, they're going to be just fine. A small percentage of people can go on to develop preeclampsia in the postpartum period, but very few. And delivery is definitive treatment. So the vast majority of people who are diagnosed with preeclampsia, you have a baby, and within 12 weeks, your blood pressure is going to go back to normal. 10% of pregnant individuals with preeclampsia, on average, 10%, will be diagnosed before the 34-week mark.
Okay, so
and those are the patients we need to watch very carefully, because they tend to be the ones who develop higher blood pressures, can go on to have more complications, and may ultimately wind up needing to be induced or delivered by cesarean, is still in that preterm phase. So lots of considerations for the baby as well.
Okay. And so from my reading, it looks like about 5% of pregnant individuals will face a potential diagnosis. So have a diagnosis, a positive diagnosis of preeclampsia or suspected.
Yeah, the numbers range a little bit, but on the spectrum for sure. And again, like so many things in life, it is a spectrum, and it begins with, at the mildest end, what we would call gestational hypertension. So blood pressure that tends to rise after the 20-week mark in somebody who did not previously have high blood pressure, but with no other evidence of, again, what we call end organ damage. So there's no protein in your urine, your platelets are fine, your kidney function is fine, you don't have headaches or vision changes, no abdominal pain, no new onset or worsening swelling, just the high blood pressure. That is pregnancy-induced hypertension or gestational hypertension. A step further along that spectrum in terms of severity is what we would call preeclampsia. So again, the high blood pressure with another feature from that list. So maybe there's protein in your urine, maybe you have lab abnormalities, maybe you have symptoms, and then you move on to sort of preeclampsia with severe features, which would be a much smaller group of people, where you've got really high blood pressure, like systolics of 160 or above, or diastolics of 110 or above, again, that top and bottom number respectively, along with some of those severe features. And then obviously the smallest group of people who would go on to actually have a seizure. And I've between residency and my first year and a half in practice, I've only ever seen that happen once. So yeah, no, fair enough. So, but no, there are lots of people that will go on to develop a blood pressure related diagnosis on that spectrum at some point in pregnancy. So again, given that the odds are, as you say, 1 in 20 to 1 in 25, really important that, you follow up regularly and, and receive good sort of evidence-based prenatal care.
Yeah, for sure. So, and then what happens? Let's say I'm pregnant. I come in to see you for a routine late pregnancy checkup, and you say, Leanne, your blood pressure looks really high. So what's going to happen now? So
assuming you're feeling okay, your pregnancy has otherwise been uncomplicated, your baby looks good, we follow you along very closely, and then plan for induction. Sort of, it depends on sort of the practitioner specifically, but typically by kind of, 37, 38 weeks, you're going to plan on having that baby.
Yeah, because delivery usually resolves the condition.
Is treatment. Yeah, you do not want anyone to go on any farther than they need to, as far as pregnancy, if they have a diagnosis of preeclampsia.
Okay, great. So yeah, so that it's quite a serious issue.
It is, and I think one of the things that can be frustrating for people is, and we see this in non-pregnant individuals, male, female, with regards to blood pressure in general. For most people, it's a silent condition. So the fact that it's this hardcore diagnosis that they need sort of more intense antenatal surveillance or monitoring of the unborn fetus, and then maybe even induction, that frustrates people. And there's a big perception out there that, lots of doctors will look for any excuse to induce. And that absolutely is not the case. I mean, we wish spontaneous labor and sort of natural progression for anyone. But when the objective signs are there staring you in the face that preeclampsia is a present part of any particular pregnancy, you got to deal with it seriously.
Yeah, for sure. Is there anything that someone who maybe has a slightly elevated blood pressure, is there anything they can do, or is this completely like do we really even know what the real pathway for this is?
So as far as what causes preeclampsia, we know that it has lots to do with the interaction of blood vessels at the uterine wall and the placenta. So there are really complex sort of physiologic theories around how blood vessels form early in pregnancy and how they may, under certain stressful conditions, become more reactive in this way. But all of that aside, the clinical reality for pregnant people is that, yes, I mean, first of all, we know that anyone who's had something before, rule number one, they're more likely to have it again. So if you had preeclampsia in a prior pregnancy, you are more likely to have it in a current or subsequent pregnancy. And then people with related conditions. So if you have high blood pressure, if you have kidney disease, if you're a first-time pregnant person, if you're what we call a nulliparous person, you are more likely to have preeclampsia. Individuals over the age of 40 or under the age of 18, if conception was achieved via in vitro fertilization. Obesity, we know that individuals who are carrying significant amounts of excess weight, they tend to be at risk. So lots of things to look for right from the outset, which is why I always say to people, the best pregnancy is a planned pregnancy. Typically, we welcome them in all sort of, via all methods of arrival. But we typically, if you're planning to get pregnant, optimizing your health as best that you can before conception is huge to avoid some of the risk factors that can play into the likelihood of a preeclampsia diagnosis.
Yeah. Okay, great. Because there's things out there. I'm sure you've heard of the brewer's diet, and I see, because I tend to hang out in a lot of places where doulas and other sort of paraprofessionals are hanging out and talking about things. And whenever anyone does bring up high blood pressure, or they have a client facing an induction due to suspected preeclampsia, there's all kinds of suggestions thrown out there. So if I come home from your visit, is there anything I can do that will mitigate my risk of developing more severe circumstances or avoiding things like an induction?
So if you are pregnant and have received an official diagnosis of preeclampsia based on blood pressure plus another finding that we discussed earlier, you have preeclampsia for all intents and purposes. And although, of course, you want to treat your body like your temple to the extent that you can, you need to follow along as per guidelines. I think best recommendations as far as lifestyle modification, optimizing your diet, exercise, all of those things, those really are considerations in the pre-conception period and in the early pregnancy period. Okay. You want to get fit, you want to eat sort of the plant-rich Mediterranean diet, you do want to watch your salt and caffeine intake, all of those good things. But typically those are all sort of preconception, early pregnancy. If a diagnosis of preeclampsia has been made, unfortunately, you do just need to sort of follow the evidence and listen to your doctor.
All right. Well, that makes really, really good sense. And I appreciate that, because it's great that I have the access to talk to folks like you who can give me the lowdown, like, is this something we can work with, or is this something that's like a straight up diagnosis and there's a straight up treatment plan? And it, as you're saying, there's a straight up treatment plan that is trusted and is very reliable. So it's very comforting for me to be able to hear that and then be able to pass that information on to other folks like the people who are watching today, clients down the road. So thanks so much for helping us learn about preeclampsia, how it's, can be dangerous, how we recognize it. And before we go, like, if I'm just at home, maybe I'm between doctor's visits, what are some signs I could be looking for? Just be mindful of, just in case they're indicators.
Yeah, absolutely. So, I mean, I would say number one, pay close attention to what your blood pressure has been all along throughout your pregnancy. I think it's easy to have the cuff slapped on and to just, have the nurse or doctor take it and to not really pay attention to what the numbers are. But pay close attention, because you want to keep a running log in your mind of, have I always been normal? Have I been pretty low? So that should you check your blood pressure at home or at a pharmacy or at a friend's house, not in a formal clinical setting, that you have some sense of what that pressure is like relative to what you've always been. But from a symptom standpoint, the things you're looking for are headaches, the kind of headache you've never had before, a bad headache, vision changes, abdominal pain, kind of, above the belly button, right in the middle or off to the right-hand side. As I said earlier, sudden onset or worsening swelling, typically in the lower extremities, but really can be all over. These are the kinds of things that you're looking for, and patients will often describe a general feeling of just unwell. Something's not right. I don't feel the same.
Okay.
And again, in the setting of high blood pressure, you would want to have a pretty high index of suspicion for preeclampsia.
Awesome. Okay. Those are definitely some things that we can look out for on our own, and then pay attention to on our ongoing prenatal meetings with our physicians and our midwives. Awesome. Well, thank you, Brian. I really appreciate that you've taken some time out of your day today to share this information with us and, maybe give us the straight goods on what's going on when you have an elevated blood pressure during pregnancy, especially in the latter part of pregnancy, and how that can impact a pregnancy and birth plans. So thanks for joining us today.
Thanks.
I'm going to let you get back to your patients.
No problem. Much appreciated. Have a nice day. Stay safe. See you soon.
Thank you very much.
Bye now.
Bye-bye. And thanks, everyone, for joining us. We will see you again next week. And I don't know what the topic is next week off the top of my head, but it's going to be another good one. So please join us every week at noon on Wednesdays here on Birth and Baby Talk. Afterwards, we are always posting over to YouTube, and don't forget to join our newsletter. We will have the link in the comments, and you can get signed up because we share links to all the shows. We give you a heads up. There are coupons every month for services offered by Family Doulas of Ottawa, Toronto Family Doulas, and Hamilton Family Doulas. And we share lots of great printables and information for folks. So come join in, get on the list, and stay in the know. We'll see you next time. Thanks for coming.